Hi everybody, welcome back to my channel. Today I want to talk to you about a trend that I'm seeing in the mouths of our patients since we got back from being closed during the pandemic. And that is particularly to do with gingivitis and gum inflammation. And it's really important that people realize how crucial that the health of the gum tissue is. So I want to talk about what we're seeing, what you can do about it, and what it all means for the long run. If you'd like to hear more about that, let's get started. So during the pandemic, we were closed for about 2.5 months. Now, prior to that, we had a little bit of a slowdown in our hygiene anyway. And so we are pretty backed up like a lot of offices. There's many people that were due for regular routine care, especially those types of patients that need to see the hygienist more often for deep cleanings because they have what we call periodontitis, which is sort of like an advanced form of gingivitis. And it's those patients that I said to my hygienist, I said, look, the biggest victims of, as far as dentally, that's going to happen during this whole thing are the people that were kind of on the edge of, we were stabilizing their inflammation of their gums by seeing them every 3 to 4 months. And now everybody's off track. So it isn't, it's those patients. We've actually seen patients come in. We've had to take some of their teeth out because they kind of fell off the cliff, if you will. But what I want to talk about today is, you could be headed there, and this pandemic has slowed everybody down. It's made us also, some of us, fearful to go back in to see the dentist. So it's maybe a long time before you get back in, or there may be some things that you're seeing in your gums that we could perhaps help discuss and address so that things aren't as bad when you do see one of us when you come back. So the first thing is, what is gingivitis and periodontitis? There's 2 levels of this disease. The first is we get a presence of bacteria. They're not regularly being removed. They take, usually takes 2 to 3 days for them to start to really form, a mass change in the gum tissue. And it's usually right underneath the edge of the gum tissue. And it can cause everything from increased blood flow, which would be swelling of the gums, to then they also look redder. So if your gums are starting to look red or a bit puffy, then it's really important that you pay attention and do some more deeper cleaning and make sure you are trying to get in to see the hygienist sooner than later. When the puffiness and the cycles, if this has been going on for a number of months, you can actually have bacteria that will travel down deeper into the pocket or the envelope of tissue that surrounds the tooth, and it will actually cause the bone to disappear as well. And that then gets into the next phase, which is periodontitis. So the periodontium includes the bone. The gingivitis or gingival is just the gum tissue. So if you have periodontitis, you've started to lose bone. Now, people will see the biggest change in this when they start to notice they have recession. And this is like a big key thing. Recession can go very slowly, but it can actually happen really rapidly as well. So the ultimate thing is to just never let any of that happen. I mean, flossing regularly, removing the bacteria that are below the gum tissue through flossing and or a water pick regularly is going to keep you out of trouble. But it's usually not where we, find patients start complaining. They start to complain when they see their gums are bleeding whenever they do touch them or floss them or even sometimes brush them. And they start to get really red and angry. And now, again, you've either had that early stage called gingivitis, or you may have a more advanced stage called periodontitis. When the bacteria have been just sitting there for a shorter period of time, maybe a few months, the bacteria and the buildup that occurs around the tooth will harden into a form called tartar. And that tartar can be removed with the hygienist, but really ultimately it doesn't cause any long-term damage. What we call gingivitis is what we call the reversible form of gum disease, okay? So once though it's gotten into a deeper stage, or you now have recession or bone loss, that's periodontitis, and that is now what we call irreversible stage. all you can do at that point is really try to keep it from getting worse. So you're never going to get the bone back. I've always lost that bone or tissue. I'm going to talk about it in a second, a couple ways we can surgically deal with it, but we don't want to have to go there. So the best thing is if we're taking care of our daily maintenance at home. It's like anything. If you exercise every day or you try to go out there and run a marathon once a year, it's really not going to help you the same way as if you exercise every day. So you really have got to try to make these daily habits, again, where we're all backed up, dentists all over the world are backed up. You're going to have to do it a little bit more focus on this part of your health and your oral health to prevent that. So the good news is that gingivitis, again, takes a long time to get to periodontitis and is very reversible. If we can get the bacteria out of there, get the tartar out of there, take better care, floss more often, then you'll notice your gums will get pinker and not as red, and you'll have no bleeding in the gums when you do floss. If you started to notice that you have recession, or you notice that, there's maybe an odor, this is where sometimes two people get into bad breath, and they don't realize because they think, well, there's just, I just have bad breath. But it's often the bacteria that are now in those deeper levels of that is causing that bad breath, because the bacteria are basically like putrefying or sort of like cooking, if you will. I know it sounds gross, but deeper down, and you can't reach anymore. So your hygienist really has the tools to get to those deeper levels. You can floss to a depth of about 3 millimeters, but your hygienist can get much deeper than that with the special tools that they have. So that's why, again, it's really important to get into those deeper levels with the hygienist, if that's what you're noticing. So recession, though, is one of the big ones, because people really often are concerned. They know that this doesn't look good. They're like, all of a sudden, it's about the way it looks, right? I mean, and I get it. But I really know that sometimes our patients can't prevent what we call recession. There's another reason for that. I'm going to explain it in a minute. But when you have periodontitis, if you just have the deep bone loss around the tooth and you don't have recession, then that's just something that your hygienist is going to have to help you maintain every 3 to 4 months. But once the gums have started to recede, now again, people start to notice this. They don't like it as much, and you may even actually get more sensitivity. The thing about it is that often people think, that they just, oh my God, I brushed too much, I brushed too hard, and I shouldn't have done that. So they go out, they get a softer toothbrush, they do less flossing. It actually works against you, but ultimately what we now know in studies is that recession really isn't caused so much. It can be part of a gum disease problem, but it often is also associated with things like clenching or grinding, or people that have crowded teeth, or teeth that are tipped in a certain way that put an abnormal vertical force on the tooth, and it tenses the tooth right at the neck or the gum line, and that's causing the gum tissue. So really, annually at least, having your dentist check your mouth for changes in the gum tissue or changes in recession is really important, because maybe there's actually a shift in the position of the teeth and the forces of the teeth, which is causing this. So no amount of cleanings in the world and no amount of brushing with a soft toothbrush is going to save you from that. And that's, again, gets into our bite and gets into a great reason to do something like clear aligner therapy, which is like Invisalign, to upright those teeth and get things back into a nice straight position. It's like when when we walk around hunched over, we tend to have more back pain, we tend to have more problems, our muscles have to compensate. But when we walk around with our back straight and we have great posture, we tend to have less problems. It's just like that with our teeth. If our teeth are tipped over, you're functioning on tipped over teeth. You're going to see fallout from that, from tooth wear, chipping, to also this recession, which everybody again starts to ask me, what can I do about this? If you want to do more at home, what I would suggest are 3 things. The first is to get out the floss, and I don't care which kind of floss you use. However, I will say floss that you can manipulate with your hands, as the free-handed form, is going to be much more effective than just the floss sticks, but I'd rather see someone using the floss sticks than nothing at all. The reason why I say that is because we have to think about our floss wrapping around our tooth and going underneath, just like you would wrap a rope around a pillar on a wharf to tie up the boat, okay? So you want the floss to go right around that nice cylinder, like it's a tooth, and go down, because it's going to clean the walls of the tooth. That's where the bacteria is sitting. The next thing you want to do is set up some sort of little timer in your phone. If we don't have reminders, we're all extremely busy. I think it's really helpful to do that. And one last tip that I would say about flossing, and again, nobody wants to hear it, I mean, it's like, oh, we're always told to floss, is thinking about places to put the floss so that, again, it reinforces that good behavior. I will get this tip. I know I'm going to give Jennifer Aniston a shout out here, but she flosses in the shower and leaves the floss there because you're waiting for the conditioner in your hair. You're doing something where, you know, like, again, you're waiting for the hot water to warm you up. So why not floss during a period when you're really kind of like you're stuck somewhere anyway? Okay, so these are little tips that I would suggest to do that. The other thing is if you have more advanced forms of gum disease, which is the periodontitis, really try your best to make sure you are getting in regularly with your hygienist. Book that appointment right away. Don't delay that because everybody is very backed up. And if you do have recession and some other gum problems because your teeth are kind of tipped over, then you could think about talking to your dentist about clear aligner therapy or looking at some sort of nighttime appliance that prevents the forces from being so hard on your teeth when you're sleeping. I really hope those tips helped, and I will love to have any feedback or tips or comments. Please leave me a comment below, and don't forget to like and subscribe, and I will see you next time.